Welcome to Channel 17, the Town of Colonie Government Channel.
Hello and welcome to Focus on Health. I'm your host, Peggy Mello. Today's guests are Saskia Thiadens, the Executive Director of the National Lymphedema Network, and Heather Carangelo with St. Peter's Hospital Physical Therapy. Welcome to the show, ladies. Saskia, let's start with you. Do you want to talk about what you do and talk a little bit about the network?
I love to. Thank you very much for inviting me. And I'm a nurse by profession, and I became aware of the lymphatic system and the ignorance of lymphedema in the middle 80s, and at the time opened the very first clinic in the United States in San Francisco. Shortly after, I realized the tremendous ignorance and became aware of the need of a national clearinghouse, which I founded in March of 1988.
Oh.
The mission of the NLN is to create awareness about lymphedema through education and to promote and support quality medical care for patients with lymphedema and patients who are at risk for lymphedema.
And I'm assuming you work on legislative efforts and advocacy too.
Yeah, we work on legislative issues and advocacy, and the NLN actually also plays a major role in the education of therapists. Presently, we have over 180 affiliated lymphedema clinics throughout the United States, and support groups. And we also have a quarterly 36-page newsletter, LymphLink, which is for healthcare professionals and for patients. And we also organize biannual international conferences for healthcare professionals.
Okay.
We are a membership organization, and we really focus on the whole educational part and support patients and healthcare professionals and the general public. I'm celebrating this year actually the 20th anniversary of the National Lymphedema Network, and I'm very proud we're really moving into mainstream medicine and becoming more and more identified by the medical professionals. So we're making progress.
Great. Thank you, Saskia.
Thank
Okay,
you.
Heather, do you want to just talk real quickly about your background and the clinic?
Yes, I have been a physical therapist for 20 years and became interested in the field of lymphedema in the mid-90s thanks to some of the oncologists in our area who had noted the condition and approached us and asked us if we would then develop a program to treat these women with lymphedema.
Mm-hmm.
So in 1995 we opened our clinic at St. Peter's, where we've been treating, we started off just treating women with breast cancer who developed lymphedema, and over the years we've expanded our program and treating the whole body lymphedema as well, all the limbs.
Great.
So it's been a very successful program, and we now have our clinic off-site out in Slingerlands, and we've been there for 8 years now.
Great. Okay, Saskia, why don't we start with the definition of the disorder?
Oh,
Just
sure.
so we understand what it is.
What is lymphedema? Lymphedema is an accumulation of protein-rich fluid in the interstitial tissue, and so decreased lymph capacity, lymphedema can develop most usually in the arms, legs, or other parts of the body as well.
Mm-hmm.
And the purpose of the lymph system is to purify the body from impurities and bacteria from body tissue and produce cells of the immune system, which are really vital in killing infections, which we often see, when the immune system isn't functioning correctly. The lymph system consists of lymph nodes, lymph vessels, and lymph tissue. We have over between 400 and 700 lymph nodes in the body, and the purpose of the lymph nodes is to purify. The purpose of the lymph nodes is they act like a filtering station to purify the body from bacteria, viruses, and malignant cells. And if lymph nodes are removed, unfortunately, fluid can back up, and just like the plumbing system, and fluid can back up and move into the tissue, causing swelling of the arms or legs or other parts of the body as well.
Okay, so let's say somebody that's had a lymph node removed after breast cancer, they have an accumulation of fluid in their arm, and then is it uncomfortable? Does it hurt?
Obviously, it's not only uncomfortable, but you can imagine, the psychosocial aspect of a person with a large swollen arm. And often what happens after the woman has gone through breast cancer surgery, and then all of a sudden she develops swelling on her arm and goes to her doctor, and her doctor tells her, don't worry about it, it will go away, or there's really no effective treatment for your swollen arm. You can imagine that's very concerning to a person. And if no treatment, the limb over time will increase in size and can lead into complications such as skin breakdown and infections. And often it affects, vocational issues, and of course it affects your whole family life and overall the whole quality of life. The good thing is, Peggy, that there is really effective treatment today for lymphedema. Complete decongestive therapy, and it's crucial that physicians need to begin educating their patients about the risk reduction practices. The reason why doctors are not talking about, because it's hard to believe, but the lymphatic system is not educated in medical school. It's not part of the curricula.
Okay.
And consequently, many physicians really have no knowledge and minimal interest in the lymphatic system.
So do you think that there's maybe the doctors are sort of ignoring the problem, or do they just generally tell their breast cancer patients that it's just something they have to live with and not be treated?
Yes.
They may not be aware of the treatment that's available.
Exactly.
It's what we're finding out is they're not aware that there is a treatment available, and they'll tell their patients that, either it will go away or you just have to live with it. And a lot of times, unfortunately, the doctors don't even mention the condition until it's already developed. So a lot of times I don't believe patients are aware that it could develop. Some are, but some are not.
Okay.
So it's not until after they get it, then they go to their doctor and they're looking for something to happen at that point, treatment-wise.
So is the most common cause of lymphedema removal of the lymph nodes after breast cancer surgery, or are there different classifications of lymphedema?
There are different causes, not only that we see it in breast cancer, but we also see it in gynecological cancer, head and neck cancer. Whenever lymph nodes are removed in the armpit, in the groin, or in the cervical area, people can develop lymphedema. So it's really important that physicians, when a patient is diagnosed, that they need to begin educating patients before the actual surgery, so that they are aware that this can happen and that there's treatment available. And it's beginning to happen more and more. The National Lymphedema Network has some wonderful position paper risk reduction practices, which are widely being used throughout the country in breast centers and hospitals and physicians' offices. So, and of course, patients who are diagnosed with breast cancer and they go to support groups and they're sitting next to a woman with a large swollen arm, of course, they are concerned and they will raise the question, what is this? And often they go to the website, and patients often educate themselves because their physicians, unfortunately, are not providing this.
Okay. Heather, why don't you talk about the symptoms of lymphedema?
Yes. Initially, people will notice symptoms of fullness or heaviness in their arm. They might notice first signs like their rings may no longer fit on that particular arm. A blouse may fit snug when before it was loose. Those are usually subtle symptoms that patients first notice. So initially, they will feel the fullness. Rarely do they have pain. It's more the fullness, the heaviness in that limb. As the condition worsens, the arm or the leg may get disfigured. And they could also start to lose mobility and function of that arm due to loss of motion and the heaviness. The skin can eventually become stretched out. The skin can become taut. So it becomes more evident the longer that it is left untreated.
Okay. And Saskia, what about the incidence of the disorder?
Good question, Peggy. As a result of the ignorance, as you can imagine, there's minimal research being done, even more in the incidence. So we can say today that between 7 and 48% of women who undergo breast cancer at some point through the course of their life will develop lymphedema. Now, since the early 1990s, we have the Sentinel lymph node dissection, meaning that only one lymph node will be removed, 1 or 2 nodes will be removed to identify if there's actually cancer. And if that's negative, then only 1 node will be removed, and the risk is much less of developing lymphedema. Although we do know that between 7 and 17% of patients who undergo sentinel lymph node dissection do develop lymphedema. But absolutely, it's less than the full axillary lymph node dissection. All other cancers, we have really no data available at this point, mainly because no research really has been done so far.
So as the executive director of the NLN, are you trying to get some studies started on the disorder? Is that part of what you do?
I'm very pleased to tell you that more and more academic institutions throughout the United States and of course across the world are beginning to do research, clinical research, epidemiology research, some genetic research is being done as well now. So the field is definitely growing, and there's increased interest, and more physicians are becoming involved in the field. But it's slow. It's slow, and I still talk about we are still the stepchildren in medicine, because very few people really want to talk to us, and at the same time you can't hide it when you have a big swollen arm or swollen leg. And it's again not only in the arms and legs, but we see it in the truncal area, we see it in the genital area, we see it in the abdomen.
Face and neck region.
Exactly.
Can become involved.
Well, if I were you, I'd be at every single oncology conference in the United States, handing out everything to the doctors.
That's
sure
been
that they know about you.
That's what we've been doing, and we recently finished the 8th international conference, and over 1,000 people attended from around the world, and some of the latest research, was presented. So the field is growing.
Okay, great. Heather, let's talk about treatment. There must be different grades that you have. I mean, how do you diagnose the severity of the lymphedema in a patient?
When we first see a patient, we'll usually take circumferential measurements around the affected limb, whether it's the arm or the leg, and we'll compare that to the opposite side. If both sides are involved, we'll still take measurements to give us a baseline, and then we go from there. Or we'll often have to rely on the patient to remember what their arm was like prior to the condition starting. So we do take baseline measurements that we have. And then as far as treatment, it's complete decongestive physical therapy, where we use a technique called manual lymph drainage, which is a very gentle massage that's used to stimulate the intact lymphatic system and to facilitate the movement of that lymph fluid out of the affected limb. And that is followed with compression bandaging, which is probably the most important part of the treatment. And these are short stretch compression bandages that look like an ACE bandage, but they're a short stretch bandage, so they are very different from an ACE bandage. But these are put on the limb, and it's on a theory called gradient compression. So the highest amount of compression is at the furthest away point, whether it be the hand or the foot, and then that limb is bandaged all the way up to the top. And those bandages actually act as a very subtle compression pump, very subtle compression mechanism to help pump that fluid out of the limb.
It's pumping the fluid up that way?
And what we do with our massage technique is we reroute it, so we do not want the fluid to drain back into the affected area. We try to reroute it towards the back, across to the unaffected side, or even down the side of the trunk towards inguinal nodes. So we're redirecting the movement of that fluid with our manual technique as well as the bandages.
So that's done by you. The patient doesn't do it at home, right?
It's done by, yes, myself or a certified lymphedema therapist, but we also do teach the patient self-massage techniques, and if they have any family member that wants to come in with them, and that can be helpful for them to do it at home as well. So there is time spent with the family member so that we can teach them self-massage. They're taught the bandaging technique. We teach them therapeutic exercises that should be done when the bandages are on, and we teach them good skincare precautions as well. So that combined with our home program, we help to minimize that swelling, and then the end of the treatment program is they are encouraged to get measured for a compression sleeve or a compression stocking. So these garments will maintain that limb size by providing a nice even compression. So once we get that swelling to a minimum, then we do have them go after that compression garment.
And then that's a sleeve that they can take on and off.
Correct. They wear that just during the daytime, goes on first thing in the morning, they wear it throughout the day, and then they remove that before bedtime.
I would hope it comes in different colors to match their outfits, right?
Not too often, nope. Beige or beige.
They do come now in different colors and different patterns. They are now available.
Okay,
So
so we
it's more
have
fashionable.
we have the bandages and we have the sleeves. Okay, and that's basically it.
Yes.
Okay, great. All right. What about education? Where can a person diagnosed with a disorder go for education?
Well, again, what we talked about, physicians don't provide information and education, to patients. So patients often end up being their own advocate. The National Lymphedema Network, we do have a lot of information about risk reduction, air travel information, exercise, post breast cancer surgery and lymphedema. And so patients do reach out to us, or they go to their local support group. If they're fortunate, if they have if they have lymphedema, then they can find a clinic such as Heather, and the clinic, of course, has a lot of educational information available. But I can't overemphasize the importance when patients are first diagnosed, specifically before breast cancer or also lower extremity, to get a baseline measurement before the surgery, so that we can really identify the size of the limb, and then post-surgery start measuring 3 months, 6 months, 10 months down the line. We're very excited. There's some new technology available today. It's the bioimpedance. It's a very simple electrical it's a device, it's called the LDEX, that patients actually can identify their own extracellular pressure in the limb before symptoms occur, when they're in the subclinical stages. So if we can catch lymphedema early before symptoms show, that's the best of all worlds. And so that's really the latest diagnostics, what's available to identify early lymphedema. And recently, lymphedema became a standard in a new organization, the National Accreditation Program for Breast Centers, which is a new program, and many breast centers are signing up to become part of the accreditation program, and they added lymphedema as a standard. In other words, they have to measure limbs before, and they have to follow patients every 6 months and every year and continue measurements. So that will really allow us to look at changes in the patient's limb. So that's very exciting. It's really the first standard in lymphedema.
If somebody wants to contact the National Lymphedema Network, can you give the toll-free number and the website, please?
Of course. Our toll-free number is 1-800-541-3259. And our website is www.lymphnet, LYMPHNET.org.
Okay. Now, I also did a show on the local organization CRAB, C-R-A-A-B, which stands for Capital Region Action Against Breast Cancer. So if anybody just goes into Google, they can go in and find CRAB. I know that CRAB does a good amount of education as well. I can also speak for our library website, colonie.org/library. People can click on online databases and go in and do their own journal searches. They can get health articles from the Health Reference Center Academic, and they can also get scholarly journal articles as well, and all they need is a library card number. So let's remember that too. Let's talk about risk reduction practices. What are they, Saskia?
Thank you. That's such an important question, Peggy. Again, we've talked about the importance of educating patients before surgery and post-surgery. So a person who's had lymph node dissection should never have a blood pressure taken, should never have an injection, should never have a venipuncture in the affected limb. Avoid heavy lifting, avoid repetitive motions. When you work in the garden, ideally wear some gloves, same in the kitchen. You want to basically avoid injuring to the tissue and possibly, leading into infections. There's a huge incidence of infection in patients with lymphedema, and that's why it's so crucial to start treatment early, because if you wait too long, protein will accumulate in the tissue, and that creates an environment for bacteria to grow, and patients are at higher risk for infections. So very important that patients need to follow risk reduction practices.
Airplane travel as well.
That's what I was going to mention.
Airplane travel and saunas and hot tubs as well can cause the...
So you're saying they should avoid airplane travel?
No, they should not avoid airplane travel at all. Patients without lymphedema, if they go on a long flight, they should ideally wear a compression sleeve and be measured and fitted before the flight, and make sure that it fits correctly. And because if it's too loose or too tight, it actually can create lymphedema. But clearly, as a result of decreased cabin pressure, that people can develop lymphedema or worsen the existing lymphedema.
And I would imagine that direct flights would be better than connections.
Absolutely.
So they're not going up, down. They're just going up, and then they're going down.
So true. Yeah, good point.
Okay. All right. What are the tips on how to find a certified lymphedema physical therapist, Heather?
Through the through the National Lymphedema Network, they are listed on there. So through their website, the other option is to check. You can call other area hospitals. Our website is stpetershealthcare.org, and it should be on there. But there is a very thorough and complete list through the National Lymphedema Network where you can find certified lymphedema therapists in your area.
Okay, and how do you become Lana certified? L-A-N-A. They should look for a Lana certification?
Yes. It's after completing your academic coursework, which is 135 hours of coursework, you then take a national exam, and upon completion and passing of that, you become Lana certified.
Okay, that sounds great. Let's talk about reimbursement. I know there are some issues here. Do you want to talk about maybe HMO reimbursement for the treatments and/or sleeves that people need?
Well, overall, the reimbursement continues to be really poor in the treatment of lymphedema, and actually rather than it's improving, it's getting worse. Again, lymphedema is a chronic condition, and people will require ongoing treatment for the rest of their life. Not only the treatment, but the garments. And garments often are very expensive, specifically if it's a custom garment. Today, Medicare doesn't cover the treatment of lymphedema. And we are working very hard on legislative issues. And I know in the state of New York, you have several bills sitting here, and
really,
and you probably know more about the bills. Overall, the state of reimbursement is very poor, and as you can imagine, if treatment and garments are not reimbursed, patients can't continue the treatment, and they have to often pay out of their own pocket. I'm very happy to tell you that recently the National Lymphedema Network created a garment fund. It's called the Maryland Westwood Garment Fund that patients can apply for, and they have to go, through a whole qualification process. But it was a patient, Marilyn, who passed away recently from gynecological cancer, and she just decided that she simply couldn't. She wanted to make sure that patients wouldn't endure what she went through towards the end of her life, and so she donated a substantial amount of money to the National Lymphedema Network. So the fund is really exciting, and many patients are applying for this, so people can contact the NLN.
Now, Heather, can you tell me how much is covered on an annual basis for physical therapy?
It varies based on the insurance that the individual has.
Okay, obviously.
Yep, but the bandaging supplies, very few insurances cover the bandaging supplies, which is the actual treatment part of the program, the compression bandages. Fortunately, for our program, over the past several years, we've been funded by the Susan G. Komen Foundation. So for several years now, we've been able to write grants and get funding from them, which provides bandaging supplies strictly for breast cancer patients. So we're able to help them out in a huge way. As far as the therapy visits, again, it's based on the individual coverage. Treatment for lymphedema is billed as a physical therapy service, so patients would just need to know what their own personal insurance coverage is for physical therapy. Some limit a number of visits per year, some give them a window of coverage per calendar year.
What's the Medicare reimbursement?
I don't know the exact
$1,500
amount, but it might be $1,500 per year for outpatient.
And that's easily exhausted, I'm assuming.
Yes, it is. It
okay.
is.
And how much does a compression bandage or a sleeve cost?
Bandaging supplies, say for an arm, could be anywhere between $50 and $60 for the supplies. Legs, much more.
How often do you need them?
Generally, patients need 2 sets because they're wearing a set and then a set to wear. As far as the length of time that they're wearing them, it depends on how involved their limb is. It could be anywhere from 3 to 6 weeks that they're wearing these on a daily basis, 23 hours a day.
So it's $120 every
easily. They will last them. They should last easily several months, 2 to 3 months, because they're able to wash them and reuse them. So that's help.
Better than a sleeve. How much does a sleeve cost?
Sleeves can vary.
Depending upon if it's a custom garment, a custom sleeve, it can be close to $200, if not more, depending upon the style.
But off-the-shelf ones maybe
depending
upon 40, 50, 60.
Yeah, geographically, it's really geographically, and people sometimes they order it online as well, so it's less expensive. But the overall cost is between I think $80 and $90 of a standard sleeve. So it's very, very expensive, very, very expensive. But at the same time, if people don't wear the garment, obviously their limb, will get larger again, and then they start from square one again. So garments are really important. They're also, what I should bring up, are
they're priceless.
But they're also, Peggy, are alternative garments to replace the bandages. Because patients, as Heather mentioned, when they go through the intensive program, they need to wear bandages at nighttime. A lot of times, elderly people or heavy people, they cannot necessarily do the bandaging, and so
it's hard to just even pull it on your arm,
sleeve
right?
on, exactly. So, but I'm talking about the bandages, the wrapping in between prior to being fitted for a sleeve. So there are alternative options now, and there are various products on the market that patients can just pull on, and it's much easier than the laborers, bandaging.
Okay.
So
Saskia, in a perfect world, what would you like to have in place for the lymphedema patients in the United States?
Well, the perfect world would be to make sure, number one, that every patient can get the treatment that he or she deserves. But before that, the importance is that the lymphatic system need to be educated in medical school, and every discipline needs to be educated. In other words, every physician should be familiar with the lymphatic system, not only surgeons, but every discipline. And because there are many other morbidities, many other different causes that people can develop lymphedema. We've only talked about cancer. One area that I'd like to briefly touch on is primary lymphedema. We now see more and more young families with a newborn. You can imagine when you're in your 20s and you have your first child and is born with one or sometimes two swollen limbs, and the pediatrician doesn't know what it is. That's a genetic disorder. But there is treatment for these patients, but unfortunately the overall medical community really doesn't know what to do.
So you
for
have
it.
to get the word out.
Really,
to the doctors.
really important.
Absolutely.
And we're doing it. It's growing. We're really moving forward.
Yeah, but I also think that if somebody is ill with a condition, that they should be able to get treatment and not have to worry about how much it's going to cost.
Exactly.
In a perfect world, yes.
Yeah.
Okay.
Yeah.
All right, let's talk about further resources. Contacting, let's just mention once again how to contact the National Lymphedema Network.
I love to mention that before that, I would really like to address a very important and very exciting program we're working on right now, but was recently put in place. It's named the American Lymphedema Framework Project. The goal is that in the next 2 to 3 years that we are going to be creating a consensus paper for the treatment of lymphedema. In other words, a consensus paper that every discipline will become involved and that everybody is going to be educated and that everybody is going to be able to get the treatment. This actually was created out of the International Lymphedema Framework, what comes out of the UK, and they came to us in earlier this year, and we recently all came together and we're moving forward. And the program is being housed at the University of Missouri under the direction of Dr. Jane Armour. So it's very, very exciting, and I will announce that this evening as well. But many people are becoming involved, so hopefully in the next two years that there will be a consensus paper in the United States.
Great.
Very exciting.
Okay, let's give the toll-free number again for the network and the website.
Okay, our phone number, actually our direct phone number is 510-208-3200, and the 800 line is 1-800-541-3259.
Okay.
And the website is www.lymphnet.org.
Okay. Great. Thank you, Saskia.
Thank you.
Okay, Heather, how do people contact the St. Peter's Hospital Physical Therapy?
Our main phone number is 475-1818, or our website, stpetershealthcare.org.
Okay,
That would
great.
work.
And I want to mention a phone number for CRAB, the local breast cancer organization, 435-1055. Thank you very much for coming
you.
in.
Thank you,
Saskia,
Peggy.
you came all the way from California. I can't believe it. Thank you so much. Thanks for watching. We hope to see you next time on Focus on Health.